Hello everyone. In today's video, we'll be going through some practice questions and answers for the NACC-PSW certification exam. This exam is designed for personal support workers who are about to get their NACC certifications. So let's dive right in. Question 1. The acronym DIPS stands for A. Disability, Individuality, PT, Privacy, Scope of Practice. B. Disability, Independence, Preferences, Policies, Sympathy. C. Dignity, Independence, Preferences, Privacy, Safety. D. Discretion, Individuality, PT, Privacy, Support. The correct answer here is option C. Dignity is treating each person with respect and honoring their self-worth. Independence encourages autonomy and self-sufficiency where possible. Preferences involves respecting the individual's choices and personal preferences. Privacy is protecting personal information and maintaining confidentiality, while safety is ensuring a secure environment to prevent harm. So that's the acronym DIPS, standing for Dignity, Independence, Preferences, Privacy, and Safety. Question 2. Which of the following actions would help meet a client's self-esteem needs? A. Suggesting that a family member perform the care. B. Assisting the client with performance of daily living activities. C. Encouraging the clients to perform self-care when able. D. Anticipating the needs before the client's requests for help. The first option, suggesting that a family member perform the care, can undermine the client's sense of independence and self-worth by implying that they cannot manage without help. While option B may seem necessary, it does not encourage independence and it may not fully support self-esteem, unless it is balanced with promoting self-care when possible. In option C, encouraging the clients to perform self-care when they are able to supports their independence and autonomy, and this is directly linked to their self-esteem. Option D, although helpful, may reduce the opportunity for the clients to exercise independence. So for this, we'll be going with option C, encouraging the clients to perform self-care when able. This will allow them to do as much as they can for themselves and help them to feel capable, thereby reinforcing a positive self-image for them. Question 3. Knocking and requesting to enter a client's room supports the client's rights to A. Assistance, B. Privacy, C. Services, D. Confidentiality. While knocking and asking for permission may establish a respectful approach to providing assistance, the act itself specifically relates more to respecting their privacy rather than directly providing assistance. Privacy is acknowledging the client's personal space and allowing them to control who enters. Services does not directly relate to knocking on the door. It rather respects the client's personal space and privacy. Confidentiality pertains to the protection of personal and medical information. So the scenario we have does not apply to that. So our answer here is option B, privacy. This practice helps to maintain the dignity and autonomy of the clients, thereby fostering a respectful environment. Question 4. Which law ensures that every citizen has access to health care? A. The Canada Health Act. B. The Long-Term Care Facilities Act. C. The Medical Care Act. D. The Hospital Insurance and Diagnostic Services Act. The Canada Health Act is a federal law that ensures that every Canadian citizen has access to publicly funded health care. The Long-Term Care Facilities Act addresses standards and regulations that are specific to long-term care facilities, but it does not address universal health care access. The Medical Care Act was a predecessor to the Canada Health Act, and it helped to establish healthcare funding. However, it was eventually replaced by the Canada Health Act in 1984. The Hospital Insurance and Diagnostic Services Act was passed in 1957, and it provided initial federal funding for hospitals and diagnostic services, but it does not encompass all aspects of healthcare coverage as the Canada Health Act does. So our answer here is option A, the Canada Health Act. It establishes principles and criteria for provinces and territories to receive federal funding for health services that aims to provide comprehensive, universal, accessible, portable, and publicly administered healthcare. This act is the foundation of Canada's healthcare system, and it guarantees equitable access to necessary medical services for all residents. Question 5. The residence units, A, is kept clean by the residents. B, should be as personal and home-like as possible. C, should always have dim lighting. D, is arranged for staff convenience. In option A, while some residents may be able to help maintain tidiness, it is generally the responsibility of the facility staff to keep the units clean, especially if the resident has limitations or needs assistance. For option B, the residents' unit should be arranged in such a way that they feel comfortable and it creates a welcoming, supportive environment. This will help the resident to feel more at ease and maintain a sense of dignity and personal identity. For option C, lighting should be appropriate to the needs of the residents. Proper lighting is essential for safety and comfort, and it should be adjustable to meet the residents' preferences and needs, rather than to be always dim. For option D, the residence unit should be designed primarily for the comfort and well-being of the resident rather than for staff convenience. So for this, we are going with option B. The residence unit should be as personal and home-like as possible. Question 6. A registered nurse with advanced education and who can prescribe medication is A. Registered nurse. B. Registered practical nurse. C. Dietitian. D. Nurse practitioner. While registered nurses have significant medical knowledge and can perform many patient care tasks, they do not have the authority to prescribe medication unless they pursue the additional NP certification. A registered practical nurse provides practical nursing care, but they do not have the advanced education or prescribing authority that a nurse practitioner holds. A dietitian specializes in nutrition and diet planning, but they do not provide general medical care or even have prescribing authority. A nurse practitioner is a registered nurse with advanced education, either a master's or a doctorate degree, and they have additional training and certification. They are licensed to diagnose illnesses, prescribe medications, and perform certain medical procedures, and this distinguishes them from the other nursing roles. So for this, our answer is option D, a nurse practitioner. They are the ones that have the advanced education and they can prescribe medication. Question 7. Giving responsibility of non-controlled acts refers to A. Standing orders. B. Assignments. C. Delegation. D. Transfer of function. Standing orders are written instructions from a physician or other authorized healthcare providers that allows other healthcare professionals to carry out specific tasks or administer treatments without having to seek direct authorization each time. Assignments are duties or tasks that are given to someone, however, they don't involve the transfer of responsibility for performing specific non-controlled acts. Delegation is a process by which a healthcare professional gives responsibility for non-controlled acts to another individual. It's usually to a lower-level healthcare provider, within the scope of practice and legal regulations. Transfer of function involves moving specific responsibilities from one individual or department to another, but it is not as precise as delegation, which involves specific tasks or acts within a regulated framework. So for this, our answer is option C, delegation. So in this process, a healthcare professional gives responsibility for non-controlled acts to another individual, like a nurse or a personal support worker. However, this will be within the scope of practice and legal regulations. This will allow the delegated individual to perform tasks that they are competent to handle, but would otherwise be outside their usual duties. Question 8. When a patient is discharged from a long-term healthcare facility, how is their medical record handled? A. It is destroyed to ensure confidentiality. B. It is sent home with the patient as their property. C. It is retained by the patient's family. D. It is permanent and stored in keeping with provincial legislation. In option A, destroying the record upon discharge would violate retention requirements and make it unavailable for future references. For option B, medical records are legally the property of the healthcare facility and not the patient. While the patients have the right to access their records, they don't have the right to take the original records. In option C, the original records, like we mentioned in option B, it stays with the facilities and it is not transferred to family members. So this means our answer is option D. Medical records are considered permanent and they are typically retained by the healthcare facility in accordance to provincial or territorial legislation. This ensures that patients' information remains confidential and accessible for future healthcare needs or legal purposes. Each province and territory in Canada has their specific regulations regarding the retention period, storage, and handling of medical records in order to ensure privacy and confidentiality. Question 9. Canadians who travel to other parts of the country still maintain their provincial or territorial healthcare coverage under what principle of Medicare? A. Universality. B. Portability. C. Public administration. D. Comprehensiveness. Universality principle guarantees that all eligible residents have access to insured healthcare services without discrimination based on factors like income or age. Portability ensures that Canadians who move or travel within Canada can continue to receive healthcare coverage from their home province or territory. Public administration ensures that each province or territorial health insurance plan is managed by a public authority on a non-profit basis. Comprehensiveness ensures that all medically necessary hospital and physician services are covered. However, with respect to the question that we have, the answer is option B. Portability principle allows for the continuity of care across provincial and territorial borders, maintaining healthcare access regardless of the person's location within Canada for temporary absences. Question 10. One of the differences between a PSW and an RN is that only RNs can A. Assess, plan and evaluate nursing care. B. Provide direct patient care. C. Upgrade their skills with continuing education courses. D. Make important observations about their clients. Registered nurses have advanced education and training, and this allows them to perform comprehensive assessments, develop nursing care plans, and evaluate the effectiveness of care. For option B, both personal support workers and registered nurses provide direct patient care, so there's really not much difference there. For option C, both PSW and RNs have the opportunity for continuing education. Option D as well, both PSWs and RNs make observations about their clients. However, the level of responsibility and the ability to act on those observations differs. The only difference between the PSW and an RN based on the options we have is option A. The registered nurse has the right to do clinical judgments to assess the patient's conditions and to make decisions about the treatment. However, the PSW cannot do this. Question 11. Temporary care of a person with a serious illness or disability that gives the regular caregiver a break from their duties is called A. Acute care, B. Palliation, C. Respite care, D. Chronic care. If we check page 35 of the handbook, we'll see more information about this question. But let's go through the options we have here. Acute care refers to the treatment of severe or urgent medical conditions that require an immediate attention, like infections, injuries, or surgery. It is not related to giving caregivers a break. Palliation focuses on providing relief from the symptoms and suffering of serious illnesses, particularly when curative treatments are no longer effective. This is aimed to improve the quality of life rather than offering temporary relief to the caregivers. Respite care provides temporary relief or a break from the primary caregiver of a person with a serious illness or disability. This type of care will allow the regular caregiver to recharge, rest, or even attend other responsibilities while the individual receives necessary care for a short period. Chronic care involves the ongoing management and treatment of long-term health conditions like heart diseases, arthritis, and diabetes. It does not specifically address the temporary relief of caregivers. So our answer here is option C. Respite care can be provided in-home, in a healthcare facility, or even in a specialized respite care center. Question 12. Critical thinking is best described as A. A supervisory note, B. An inventory control, C. A problem-solving technique, D. A management style. A supervisory note is a documentation made by a supervisor, but it is not related to critical thinking. An inventory control is a process used to manage inventory, but it does not involve the analytical depth required in critical thinking. Critical thinking can be described as a problem-solving skill because it involves analyzing information, evaluating options, and making reasoned judgments to solve complex issues effectively. Management style refers to the way a person directs or motivates a team, but critical thinking is a skill that is used across various management styles. So our answer here is option C. Critical thinking is a skill that is essential for identifying solutions, understanding cause and effect relationships, and also making informed decisions. Question 13. The most pressing cause of healthcare reform has been A. Lack of accessibility, B. The Great Depression, C. Rising cost of providing drugs, technology, and services, D. Lack of available technology. While accessibility is a significant issue in healthcare, especially in underserved areas or among certain populations, it has not been the most pressing cause of healthcare reform. The Great Depression had a major impact on the U.S. economy and social policies, leading to significant changes in healthcare, including the establishment of social safety nets like Social Security. However, this occurred long before modern debates about the rising cost of healthcare. In option C, the rising cost of providing drugs, technology, and services has been a major factor driving the need for healthcare reform because this has put pressure on both individuals and healthcare systems to find more sustainable and affordable solutions. For option D, though technology access is important in healthcare, the issue today is not necessarily a lack of available technology, but rather the affordability and integration of advanced technologies into the system. So for this, the most pressing cause of healthcare reform has been the rising cost of providing drugs, technology, and services. That is option C. Question 14. A medical doctor who prescribes medications and leads the healthcare team is A. Surgeon, B. Cardiologist, C. Physician, D. Pathologist. A surgeon is the physician that specializes in performing surgical procedures to treat diseases, injuries, or conditions. A cardiologist is a type of physician that specializes in the diagnosis and treatment of heart-related conditions. A physician, on the other hand, is a medical doctor who diagnoses and treats illnesses, prescribes medications, and often leads the healthcare team. A pathologist specializes in diagnosing diseases by examining tissues, organs, and bodily fluids under a microscope. So our answer here is option C. Physicians can specialize in various areas of medicine like internal medicine or pediatrics, but their primary role involves overseeing patient care, prescribing treatments, and making critical decisions about the management of health. Question 15. Immunization programs are an example of A. Home care service, B. Medicare system, C. Facility-based treatment, D. Disease prevention program. Home care services involves medical or personal care provided at a patient's home, like physical therapy, nursing, or help with daily activities. Medicare is a government health insurance program for individuals that are aged 65 or older in the United States. Facility-based treatment refers to medical care provided in clinics, hospitals, or other healthcare facilities, and it is usually for those that are sick or injured and require immediate or ongoing treatment. Immunization programs are designed to prevent the spread of infectious diseases by vaccinating individuals to protect them from certain diseases, thereby preventing the illness in the first place. So, an immunization program is an example of option D, disease prevention program. This program focuses on disease prevention rather than the treatment, and it aims to reduce the incidence of diseases like measles, influenza, and polio. Question 16. Using culturally sensitive assistance helps to develop A. Political correctness, B. Recognition and respect, C. Universal healthcare, D. High expectations of caregivers. While cultural sensitivity can align with being politically correct, its primary focus is not about conforming to socially accepted language or avoiding offense. Instead, it's about understanding and respecting cultural differences, and this goes beyond being politically correct. Using culturally sensitive assistance helps to develop recognition and respect for individuals from diverse cultural backgrounds. Universal healthcare refers to a system where all citizens have access to healthcare services regardless of their financial status. In option D, culturally sensitive assistance doesn't aim to create high expectations of caregivers. However, it focuses on making healthcare more equitable and responsive to the needs of diverse population. So our answer here is option B. Culturally sensitive assistance ensures that healthcare providers understand and acknowledge the unique cultural, religious, and personal needs of their patients, leading to better communication, trust, and more effective care. Question 17. Which of these is a subjective symptom? A. A temperature of 37.1 Celsius. B. A pulse rate of 79. C. Skin breakdown. D. Pain and discomfort under client's complaints. First of all, subjective symptoms are those that are reported by the patient and they cannot be measured or observed by others. So in option A temperature of 37.1 degrees Celsius, this is a measurable symptom. So it is rather an objective symptom because it is observed using a thermometer. Option B also is an objective symptom because it can be measured, and this is by taking the patient's pulse. Option C is also an objective symptom because it can be visually observed and documented. However, option D is a subjective symptom because it is based on the individual's personal experience and perception. So, a subjective symptom here is option D. Pain and discomfort are subjective because they are self-reported by the patients and they cannot be physically observed or measured in an objective way. Question 18. The Canadian Charter of Rights and Freedom applies to A. Every Canadian. B. Only clients with AIDS. C. Only adults living in the community. D. Everyone except frail elderly on long-term care institutions. The Canadian Charter of Rights and Freedom applies to all individuals in Canada. It guarantees fundamental rights and freedoms like freedom of expression, equality rights, and the right to life, liberty, and security to every person, regardless of their age, health status, or living situation. For option B, the Charter is not limited to specific health conditions because it applies universally to all individuals in Canada. Option C, like we mentioned earlier for option B, it is universal. It covers all individuals in Canada. So our answer here is option A. The Canadian Charter of Rights and Freedom applies to every Canadian. Question 19. A PSW's work is concerned primarily with A. Assessments, B. Implementation, C. Care planning, D. Documentation. PSWs are not responsible for conducting assessments. This task is performed by a registered healthcare professional who will evaluate a client's need and then develop a care plan. A PSW primarily focuses on the implementation of care plans that has been designed by healthcare professionals such as nurses or therapists. PSWs do not create or modify care plans. For option C, their role is to follow the established care plan as directed by healthcare professionals. In option D, although PSWs may document certain observations or events in a client's record, documentation is not the primary focus of their role. So our answer here is option B. While the PSWs may observe and report on client conditions, they do not perform assessments, create care plans, or focus heavily on documentation. Their primary focus is on implementation of the care plans that have been designed by the healthcare professionals, like the nurses or the therapists. So they provide direct care to clients by assisting with daily activities, personal hygiene, mobility, and other essential support tasks. Question 20. To maintain a professional image at work, what should a PSW do? A. Have their fingernails professionally manicured. B. Wear a clean pressed uniform each day. C. Use lightly scented perfume to cover body odor. D. Wear fashionable jewelry. In option A, while clean and trimmed nails are essential, manicured or artificial nails can be problematic in healthcare settings as they can harbor bacteria and make it difficult to maintain proper hand hygiene. Maintaining a professional image for a PSW includes wearing a clean, pressed uniform each day. This conveys cleanliness, professionalism, and attention to hygiene, which is critical in healthcare settings to ensure a safe and respectable environment for clients. For option C, in healthcare environments, it is best to avoid perfumes or scented products, as clients may have sensitivities or allergies to fragrances. For option D, jewelry can interfere with hand hygiene, pose safety risks, and may also distract from a professional appearance. Minimal or no jewelry is generally recommended in healthcare. So for this, our answer is option B. Maintaining a professional image for a PSW includes wearing a clean pressed uniform each day, which will convey cleanliness, professionalism, and attention to hygiene. This brings us to the end of Module 1 video on the PSW certification exam for NACC. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when our Module 2 video will drop. Thank you for watching, and I'll see you in the next video.